Okay, so this bit's about what happens after you're registered. So once you've undertaken the training and you're back in practice and you've got your PIN, what happens next? So this session is very much, as we said, about hints and tips getting the most out of the role, both as an employer and the nursing associate. So nursing associates can very much enhance the nursing team. So I always see the nursing associate as an opportunity to kind of grow your own nursing team, because if you, like me, worked as a HCA for many years, you know the population, you know your patients, so you can very much tailor the role to meet population need. And then that also helps with retaining talent and upskilling staff, because people will stay on where they are to meet that population need. It also provides more capacity for nursing teams, allowing the registered nurses to focus on the more complex care needs. And also the nursing associates can support the HCAs and all work together towards the same end. It provides more capacity and flexibility for patients when they're booking things. And it's very important to make that clear. We have a spreadsheet of all our different roles within the nursing team for reception staff and other staff when they're booking appointments. And it just means that there's more flexibility to fit different people in. It also, the course broadens your experience massively, as we've talked about, and your depth of knowledge, which you then bring to practice. And I'm using that every day. And it promotes that evidence-based, person-centred care, which you are sharing with patients on a day-to-day basis, and helping patients, carers, families understand the evidence base behind the care that you're providing. And this is just pulled from the Nursing and Midwifery Council, and it looks at how the role's different to a registered nurse, because there needs to be these boundaries between HCA, between nurse associate and the registered nurse, which is really important. So both accountable professionals, both committed to promoting health and preventing ill health at every opportunity. Registered nurses provide and evaluate care, so they're more involved with the assessment and evaluation, whilst the nursing associates provide and monitor care. And then obviously from the monitoring of that care can then escalate things should they need to a registered nurse or GP in primary care. Both working in teams, but it would be the registered nurse that does the leading and managing of those teams, with the NAs able to work in a more supervisory capacity. Improving safety and quality of care, both roles heavily committed to that. Registered nurses are more involved with the coordinating and the assessing needs and planning care, whilst the NAs would be contributing to that integrated care. So just to give an example, a leg ulcer patient, if they weren't known to us as a team in our practice, would see the registered nurse for the initial appointment. The registered nurse would then do a full wound assessment and decide if they needed a Doppler, etc. But then the nursing associate could then follow the care plan that was initiated at that appointment and see the patient following that. And then at any point can obviously ask the registered nurse for advice if there was complications or if there was suggestion of infection. So a top tip from our team at work is to know your team and know every individual aspect of that team, what everybody can do, their roles and responsibilities, and get that clear. Make it clear across the board to reception, to GPs, so everybody knows exactly what they're booking with different members of the team and whose role and responsibility it is for tasks and everything. It just saves so much time if the right task goes to the right person or the right clinic's booked with the right person. Identifying individual strengths, skills and interests, I think is really important. Myself and Sarah were having a conversation before about getting bored, especially when clinics all look the same, and it's about that continued learning and what strengths your team has got and building on that, so that the days are interesting and they're constantly challenged. Organising clinics to reflect both your team skills, but also population health. So if you've got a lot of people that need some lifestyle medicine advice, then booking clinics appropriately with a clinician who's interested in providing lifestyle advice, so that you bring that bit extra to those clinics, and looking at where there's gaps to identify where there's gaps for further training to help improve patient care and patient health outcomes. So in terms of how the nursing associate role can develop in primary care following registration, these are the sort of things that are in my everyday clinics. So long-term conditions and chronic disease reviews, vaccinations, so B12, influenza, shingles, pneumonia, but always working under a PSD and not a PGD, and obviously with registered nurse and GPs in practice. Assisting GPs with joint injections and minor op clinics, assisting with coil and implant clinics, and also all the checks that go alongside that, ECG and 24-hour ECG clinics, health promotion and motivational lifestyle change clinics to encourage people at every opportunity, including chronic disease reviews, how to get the most out of each appointment, so you're really making a difference between those annual reviews, and it's not just a nip in and see you next year. Wound care dressings, simple bandaging and Doppler studies. We do an awful lot of those. We've got quite an elderly population, so we do have a lot of dressings every day, and always promoting that evidence-based practice, so you're sharing with the patient why you're doing something. So for instance, if you're doing a Doppler, why are we doing this Doppler? What are we trying to achieve? What's the science behind it, I suppose, to make sure you're improving patient outcomes and ensure high quality patient care is delivered every day, which is key. And then I just like this quote from Florence: "Let us never consider ourselves finished, nurses. We must be learning all our lives," because it's just a continual journey. We're all saying at work, every day is a school day. And it's really important that we harness that love of learning, because nursing teams need to be challenged so that they stay in the role and they enjoy the role, and patients get the most out of each meeting with them. So in terms of continued professional development, so this is the bit, Sheila, regarding the revalidation. So we have to revalidate with the Nursing Midwifery Council every 3 years. So that obviously requires engagement with clinical practice as you're going along, as well as evidence of your continual professional development and reflective practice. So I work with my network, looking at making sure that they're keeping a folder with all the continual professional development, and if they have something interesting happening in practice, keeping those reflections, debriefing with your registered nurses, and doing that because you're very much in that mode from the degree, from doing the reflective accounts, that it's worth keeping that going and doing them periodically when something happens in practice, to reflect on the practice and learn for future opportunities. And then opportunities in practice in terms of widening the role for nursing associates. Once we've got the evidence-based practice and we've worked with the foundation degree on the depth of knowledge, you can be involved with research to inform new policies and guidelines in practice, clinical audits to assess and improve patient care and find out where those gaps are so you can improve things, applying those evidence-based guidelines and protocols to patient care to ensure best practice, and working with your teams and your HCAs to explain the best practice and what we're trying to achieve as a team, and educating patients and families on how to improve their patient outcomes by following evidence-based guidelines, and looking at where you can signpost patients and families to get more information. So my top tip is that the Nursing Associate Apprenticeship degree requires a lot of commitment, both from practice and from yourself as an individual. And once registered, nursing associates are really keen to continue that learning and develop the skills. And practices really need to harness this enthusiasm and use it to develop and improve practice, because you come out with all these new skills and knowledge, and you want to be using those to improve patient care. So my personal learning journey since qualifying last January was, I had asked for an appraisal once I returned to practice full time, and with my nurse manager I identified areas for development, and then as a team we looked at where the gaps were and what our population needs were, with change of staff and people working different days, and where it was that we had these gaps. And then this year I've been working with the registered nurses to undertake more complex reviews, so the asthma reviews, dementia reviews, learning disability reviews, and undertaking training with colleagues and doing insight days and using what I learnt off placement to ensure we're doing the very best for our patients. And I'm currently studying to gain my ARTP qualification, which will enable me to undertake spirometry for diagnosis of asthma. So working alongside my registered nurse and the GPs and the respiratory lead to make sure that I can undertake a spirometry reading which is reproducible and accurate. So in terms of what next, really the future's bright, because for NAs you can go in lots of different directions. So in terms of training courses, the spirometry training, cervical cytologist training, so you can undertake smear tests, childhood immunisation training, practice assessor training, and then looking at those leadership opportunities in ambassador roles like I am with NATH, transformational leadership roles, so being involved in the auditing and looking at the service that you're providing and improving that, and then practice assessor and supervisor roles in practice if there's any students. And then in terms of topping up, once you've consolidated as a nursing associate in practice, there are opportunities to look at doing a shortened nursing degree or a registered nurse degree apprenticeship to become a registered nurse. And this is a career mapping in primary care. I can't take credit for this. This already existed when I joined the NATH team, but it's a really useful, because it's got the QR codes on, it's a really useful like signpost to the sort of things that nursing associates can undertake in practice. So if you have got a new registered nursing associate on your team, or if you're looking to have a student nursing associate in your team, once they're qualified and working in your practice, ensure that the whole team understand the differences between the different roles from HCA to registered nurse. Ensure there's clear organisational policy outlining the responsibilities so that everybody's clear on who's responsible for what within the nursing team. Work within your scope of practice and competencies at all times. So any new training that you undertake, get your competencies signed off with your registered nurse, make sure that you're completely covered and you're working very much within your scope of practice. The registered nurses are ultimately responsible for the assessing and care planning, and also for the delegation of tasks to nursing associates. So you always need to be working very much as a team to make sure everybody's happy, that registered nurses are happy with the nursing associate taking on those delegated tasks, and that those delegated tasks are reviewed and reflected on with the RN and always escalated to the registered nurse or GP if there's any issues or concerns with the patient, which is really important. So scope of practice wise can be a bit sketchy for nursing associates, but if you follow the national guidance from the NMC and RCN and don't work outside of those, then you are, you know that you've got clear boundaries within your nursing teams. Developing your clear boundaries within your organisation, because different organisations have different needs. Allowing time for ongoing supervision and training is important to develop those new skills and to reflect on the practice with registered nurses. So making sure that if you're asked to undertake something new, for instance, I'm starting to do the learning disability reviews, that you've had training, that you've had your competencies signed, that you've worked alongside and you're happy and confident to move forward, and always to speak up if you're not happy and confident to move forward. And I get asked a lot about, from my network, about what do I do if I'm asked to do a task that's beyond my competency? And I always say, always escalate to the registered nurse or GP to assess that patient and advise you RE care if you don't feel that you're confident and competent to continue. And never work beyond your competencies. And again, that's just my contact details if anybody's got any questions or if anybody wants to have a chat.
Thank you so much, Ali. That was really, really useful. We already have a question in the chat.
Okay.
Kind of linked to that last slide. So Rach asks, when you're doing a long-term condition review in your practice, if changes are needed, e.g. asthma step up or step down, how are these kind of actioned? What's the kind of process behind it?
Okay, so I'll use asthma as an example because it's a good one. So when I'm undertaking an asthma review, if I undertake the whole review, speak to the patient, get the asthma control test score, I've discussed their control at the moment, done the peak flows, and I'm concerned about a patient and feeling that their control isn't as good as it should be, then I would either liaise with we have a registered nurse who's the respiratory lead to discuss next steps forward, or I would escalate to the GP triage team if I felt it needed to be seen on the day, and then could book a follow-up appointment to look at that. I wouldn't ever change or advise a change of medication. That would always be a follow-up, either call or appointment with GP or registered nurse. Does that
so you kind of do the monitoring and evaluation and then pass those findings on to a registered nurse or a GP or another appropriate team member who can
Absolutely, because part of the asthma review is all about whether they're optimizing their medication. So there's going to be a care plan going on in the background, but if anybody needs escalating up to GP level, for a check, if I'm thinking, actually a different inhaler or a step up, but obviously I can't initiate those changes because I'm not a prescriber, so I would refer to someone that could prescribe and make sure that if it was urgent, particularly with things like asthma, that it was done the same day.
Brilliant, thank you. And Rachel says thanks. So that's good. Any other questions from anyone? I suppose a question from me is, how long does it take to step up your competencies, or is that very variable?
It's very variable, and it all depends on confidence, doesn't it? And you feeling confident to undertake something. I think because in primary care you do work so much as a team, that I'm quite confident to undertake things once I've had the correct training and my competencies signed off. But I always like to then make sure that I'm reviewing and reflecting with the registered nurse so that I can improve things. And obviously you can always escalate. If you do a review and you're not happy with anything, then you would always escalate, or you would book them a follow-up appointment with a GP or a registered nurse to review things. But as you said, we're very much monitoring and evaluating, not assessing or providing care plans. Brilliant. Does that make sense?
Yes. so part of setting up your role in a practice is establishing those boundaries and making sure everyone understands the clear differences. But even between nurses, there's often differences in competencies.
There is. Yeah. and between nursing associates as well, and what people want, you know, are asked to do within in different practices, which makes it does make it quite complicated in terms of scope of practice, which I think is why there are sometimes some grey areas. But I always say, if I get asked a question about scope of practice from a nursing associate, I always say, have you been trained? Have you got your competencies signed? Are you insured to do it? And are you confident to do it? And is your nurse happy for you to do that? You know, because ultimately the registered nurse is delegating that task to you, or whoever's, but you know, if a GP's booked an appointment with you. And if none of those things are in place, then, you know, you need to escalate it.
Brilliant. So Sheila asks, I assume she means nursing associates, do you recommend nursing associates take out insurance via the Royal College of Nursing? So do you need any separate kind of indemnity insurance? Or
my indemnity insurance is done through my practice, but I am a member of the RCN union. I haven't got any separate insurance. But I have got obviously indemnity insurance covered by the practice.
And quite often in primary care, with most of our activities are covered by Crown indemnity, and often the practice will have additional insurance that covers the majority of roles.
And it is worth checking with things like insurances, because I think because the nursing associate role is quite a new role, that often you do get these guidelines out, like the flu and the COVID protocols, and you see nursing associates seem to fall between the gaps. So it's worth just checking, and if things need tweaking, you know, policies and documents in practice to include nursing associates in there, just so everything's clear.
Brilliant. Any other questions? I do have another one. Do you regularly get debriefs and supervision?
Yes, yeah, we do team working, especially as I say, when we're undergoing things that are new, to gain our competencies. So I'd work. So for instance, this year I've been doing asthma. So I've worked with a registered nurse while she did asthma reviews. Then we did sort of team asthma reviews. Then she observed me doing asthma reviews, and then I did a few of my own and reflected back, and then I was signed off to do them on my own. It's just making sure that you've got that evidence-based depth of knowledge behind you, so that you can answer the questions and provide the best care. And if you put the work in to establish that, then you know, I feel very capable and confident to move forward, because I've had that commitment from, you know, my registered nurse to work with me.
Brilliant. Rachel's asking a very sensible question in the chat as well. Do you have protected debrief time on the ledgers with the practice nurse?
We don't. We usually have it at the end, because we have what's called admin time, that's part and parcel of our admin time. It's just how it's organised at ours. We have about half an hour where you can catch up with your admin and also debrief and discuss things like leg ulcers. And then we have a meeting once a month as a team to do a debrief, and we discuss different patients together. But in terms of debriefing after things like diabetic reviews, if I was concerned about anything, I would escalate. And mostly our patients, once they've had a review, they are either seeing the clinical pharmacist or the GP afterwards for a meds-based review. And similar with like learning disabilities, we book them in with the GP as a follow-up.
Sheila is asking, of interest, we don't use agenda for change in primary care, but roughly what band level are nursing associates paid at?
Band 4, but obviously there's scope for moving up band 4 from there, and there's no reason why nursing associates can't apply for jobs that are at band 5 but be paid at band 4, if that makes sense. There's if I know I've seen some roles advertised in primary care where there was advertised looking for nursing staff, but also within the advertisement they would consider nursing associates as well. So it's worth looking at the small print sometimes with job adverts.
Brilliant. Hopefully that's answered. Ali and I will be around for another few more minutes if you've got any other questions. But thank you so much, Ali, today for taking the time and sharing what you do. It's been really, really interesting. And I've been able to ask all the questions that I want. Pam says thanks in the chat. Thank you, Pam, for attending.
Thank you very much. And if anybody has got any other questions following the session, or you want a Teams meeting, one-on-one to discuss things, I'm more than happy to accommodate that.